I am going to explain lymphoedema. Lymphoedema is the swelling that occurs when the lymph nodes or vessels that make up the lymphatic system become blocked and damaged. This damage or blockage causes buildup of fluid in the body of soft tissues. The lymphatic system is the part of body's immune system. It develops when lymphatic system does not work properly. The lymphatic system is a network of channels and glands throughout the body that helps fight infection and remove excess fluid. It's important that lymphoedema is identified and treated as soon as possible. If lymphoedema is not treated, it can get worse.
The etiology of lymphoedema. Lymphoedema has two types, primary and secondary, and each type has a different cause. About primary lymphoedema is caused by a faulty gene, and people affected by this form of the condition are born with an abnormality of the lymphatic system. The lymphatic vessels in primary lymphoedema might be reduced in number, then second one is too large to work properly, and third one is missing. While it occurs at any age, primary lymphoedema usually develops in early childhood and early adulthood. Then secondary lymphoedema. The secondary lymphoedema is caused by damage to or blockage of the lymphatic system as a result of surgery. Often lymph nodes are removed as a part of cancer surgery. The second one is radiotherapy for cancer, and third one is trauma or tissue damage. Also, which also include immobility due to pain, age or infection, obesity. Women who have surgery or radiotherapy for breast cancer can get secondary lymphoedema in their arm and chest. Men and women who have had surgery or radiotherapy for bowel cancer, prostate cancer or cancer of the reproductive system are also at risk of secondary lymphoedema in the legs or groin area.
The classification of lymphedema. It is basically classified as primary lymphedema and secondary lymphedema. Primary lymphedema, it is also known as the genetic lymphedema, and secondary is also known as the acquired lymphedema. Primary, it is caused by the alterations in the genes that helps in the development of the lymphatic system, and secondary lymphedema, it is caused by the injury to the normally developed lymphatic system. Primary lymphedema, it occurs 1 in every 1,000 individuals. At birth, 1 in 6,000 persons have developed the lymphedema with the prevalence of 0.13% to 2%. It arises from congenital malformations such as lymphatics. Secondary lymphedema, it is the most common. Filariasis is the most common cause of secondary lymphedema. It is the result of neoplasms and their surgical treatments and radiotherapy in most of the Western countries. Further, the primary lymphedema classified as congenital lymphedema, lymphedema precox, lymphedema tarda. Congenital lymphedema, it onsets in the within the first year of the life. Edema is seen at the birth. It involves single limb extremities or multiple limbs, face or genitalia. It is most likely bilateral and involve whole leg. Its familial version is also known as the Milroy disease. The second one is lymphedema precox. It onset between 1 to 35 years of age. It is the most common type and seen in 90% of the cases. It is mostly unilateral. It is limited to the foot and the calf. Its familial version is known as mixed disease. The third one is the lymphedema tarda. Its onset starts after the 35 years of age. It is mostly rare.
Risk factors of lymphedema, that is upper limb, that is a surgery for lymph node dissection or breast surgery, then radiotherapy to breast or to axillary area, wound complication, cancer, obesity, hypertension, chronic disorders, congenital predisposition are the risk factors of lower limb, that is advanced cancer, orthopedic surgery, surgery with inguinal lymph node dissection, and post-operative pelvic radiotherapy, then family history of chronic edema, then the symptoms of lymphoedema, that is a burning and bursting sensation, general tiredness and debility, sensitivity to heat and cramps, joint problem, acute infective episodes, immobility leading to obesity and muscle wastings, then repeated skin infection, difficulty with movement, and leakage of fluid through the skin.
Pathophysiology of lymphedema. For pathophysiology of lymphedema, when blood circulates from the heart of the body out, plasma containing proteins, water and waste products, all or cell debris makes its way into interstitial spaces, from where the lymphatic system filters the fluid and returns it to the circulation. An intact lymphatic system can effectively return the lymph fluids to the bloodstream by the mechanism described earlier. However, any loss of integrity in blood, any part of the system, can cause lymph fluid to accumulate in interstitial spaces, resulting in edema. And for these, several factors can contribute to the development of lymphedema, including changes in capillary pressure, changes in osmotic pressure, changes in integrity of skeletal muscles, like fibrosis or lack of muscle tone, and from the chemotherapy or radiation treatments, or the nodes themselves, either from fibrosis, complete removal, and congenital abnormalities of lymphatic system can also result in lymphedema, as well as any severe skin trauma resulting from burns or other skin traumas or skin infection also cause the lymphedema. With any failure of any of the processes which accommodate the forward propulsion of lymph fluids through the network, the fluid builds up into the tissue and resultant swelling occurs because of the proteins and other buildups the tissues, and result because of lymphedema can occur anywhere in the body at any point, and where the drainage of lymph is compromised by any of the above referred contributing factors that reach INL.
Diagnosis of lymphedema. Lymphedema is diagnosed with a number of different tests, including physical examination, by taking account into the person's prior medical history. Then we can do a bioimpedance. Bioimpedance used to detect body fluids of the tissue. Then we do a pyrometry. Pyrometry used to detect lymph volume and the circumference changes. Then we do tonometry. In tonometry, we use to detect changes in the toughness of fibers of the limb. Then we can also do imaging test like lymphoscintigram. We inject radioactive dye into lymphatic system and tracked by the scanner. If there is blockage, we can see by the lymphoscintigram. Then we can do also MRI for the detailed view of the body. Then another imaging test like a USG, which is a high frequency sound wave, for the detailed body scan. Then we can also give a specialized CT scan or X-ray, CT scan and X-ray, which is computer created images for the detailed and accurate scan of the lymph node.
Treatment of lymphoedema. In the treatment of lymphoedema, the most common and accepted therapies are sequential gradient pump therapy, and second is complete decognitive therapy, CDT. The CDT it includes manual lymphatic drainage, short stretch compression bandaging, therapeutic exercise, and skincare. The lymphoedema is also treated with the surgical treatment, which includes Charles technique. In Charles technique, the circumferential excision of lymphodenous, removal of the affected segment from the skin, followed by the skin grafting. It is also treated by lympholymphatic anastomosis and lymphovenous shunt.